Yes, madam, started. Thank you.
Okay. So I was just saying, anybody wants to share an experience which they had in the hospital where they actually realize how important it is to take history, or if any of you, of your colleagues, missed to ask something in the history which was very important. Anybody wants to share an experience like that? No? Anybody can raise their hands. We're just talking here.
Madam, sorry, Dr. Shazia and Dr. Najma will moderate the lecture with you, okay? I'm little busy.
بس عايشة شازية ودي كياسية وإيش كذا مشكلة
Okay. Thank you, Dr. Najma and
It's
Dr.
okay.
Najma, moderate the lecture, okay?
Say. Najma raised her hand. Do you want to say something, Najma?
Yes, teacher. Because in the part of the history taking is so important. It's a so important point to the diagnosed patient, and this is the reason the all of the doctors who focus on that. I think it's in my period of practical time of the student, I don't have any see the some of part to the miss the history taking because it's a important part, and everyone and every doctor is focus on the to take history correctly.
Yeah, exactly. For example, if you're not taking history properly, you might give a wrong medicine to somebody who is 2 months pregnant, right? Because you didn't ask the history and the patient didn't tell you that she's pregnant. You might give them Epiwol or something which is toxic to the baby. So that's very important. Sometimes you might miss a medical diagnosis. You might give something like a beta blocker to a patient who has asthma. So that can be, again, very dangerous to the patient. Sometimes you might give wrong medication to somebody who has epilepsy, and because you didn't ask the patient about their history, their medical history, or their surgical history, and you give them something which can prove very toxic and life-threatening to the patient sometimes as well. Here, I'm more focusing on psychiatric history, but if you have any questions, please raise your hands and we can talk about them as well. All of you have been to the clinics and seen patients already, but that's how we start. I'd really like if you want to write a history and send it to me, and I can check it for you as well and just tell you how things can be done in a better way. But I know you have got teachers and everybody who can do it for you. But if you want to send me, I had my email address in the past lecture, so that shouldn't be a problem. So you start with the name, age, address of the patient, and do you know what do you call this? The first paragraph when you start your history with. What do you call that paragraph? Would anybody want to raise their hands? No?
Ma'am, please repeat the question, please.
Well, just when you start your history and you start with, for example, say, for example, Ayesha is a 26-year-old woman. She is resident of Khoshal Khan, any place that you want to say, and she's married and she has 2 children. What do you call this paragraph? What is it called? No? And I have a message here.
I think
Yeah? What do you think? Okay, I think I missed this person, whoever it was. It's called demographic details. All of you know this, do you? But that's okay. So demographic history is very important, even to know the address of the patient. Why do you think the address of the patient would be important? What part of the city, for example, the patient is living in? Why do you think that would be important?
دنیا مرا نادیه کن.
Okay, that's fine. Nobody's talking again. That's okay. It's important because you get an idea of where the patient is living. There are rich areas of the city and there are poor areas of the city. There are parts of the city where there's a lot of crime, or there are parts of the city which are really peaceful, and you see that people are different. So that's why the address is very important. The age is important because there are certain medication which are not given in a certain age. So you need to know the age of the patient. For example, can you tell me a drug which is contraindicated in a particular age group of patients? No? Okay, for example, you don't give Epiwall in a childbearing age woman, okay? If a girl is 19 or 20, you don't give them Epiwall, especially if they're married and they're going to have a child, because it's teratogenic. So you have to be very cautious of that as well. And once, especially in psychiatry and in other fields of medicine as well, in surgery or medicine, for example, if you're taking history from a patient, it's very important to. I think everybody should mute themselves. So it's really important that you should ask or confirm the same history from a family member as well. Have you guys been to a psychiatric ward? Do you go to what year do you go to the psychiatric ward, Shazia, or anybody who wants to tell me? Do you go to the psychiatric wards?
Yes, ma'am.
Which year?
Tell my experience. May I talk?
Sorry, I can't hear you, Shazia. It's okay. Can you write it for me? It's okay. I just wanted to know if you guys go to the medical, to the psychiatric wards. Anybody else wants to answer
استاد محترم د صدا کتا سلک زره دری وغه وای پښتو کنه دغه دی ماسرینو دومره هغه خنه ده یعنی انګلیش خنه ده نو نو ډیر خطر تاسو په غنو پیږي نو ځکه پسې هغه نه درکې جواب نه درکې زما په نظر دغه مشکل به وي شاید نور نه یم خبر
Sorry, Mom. Can you repeat?
صحیح شو استاد چی دری بگو خیره هیچ نیست مشکل خودت راست که اکثریت چی که هست دکتر صاحبا که هست تو لسان انگلیسیشان تو زیاد چی نیستن قوی به حسابت خوب نیستن زیاد از این خاطر ما گفتم اگر نه خیره مشکل
میخواستم پرسان کنم کدام سال سنف چند تب شما میرین psychiatry ward سنف 3 یا 4
صنف 5 ما میریم از ما خو آله صنف 5 است یعنی تا فعلا تیوری است در چی نرفتیم پرکتیک خواله از ما است فعلا استاد
صنف 5 نمیرین شفاخانه چه وقت میرین صنف 3
شفاخانه میریم استاد تا فعلا یعنی درسای چی ماست تیوری است و یعنی یک چند هفته بعد بخیر میریم ما
دختران میرن باز یا صرف بچه ها میرن
آل خو صرف چی میرن استاد بچه ها میرن دخترها خو نیستن اجازه
استاد هیستوری تیکینگ که هست از صنف 3 سمستر 5 شروع میشه یعنی ما
گفتم سایکیاتری وارد چه وقت میرین
سایکیاتری هم میگه سایکیاتری را از چی نمیگه از داخله جراحی یار نمیگه فقط از صرف دیگه استاد دی سایکیاتری بخش که خیلی سایکیاتری خود
هدف شما شفاخانه رفتن بود یعنی از صنف 3 شروع میشه
Oh, I think that's universal. That happens in everywhere in the world. But okay, Jose, yes. Anybody wants to share a story when you saw a psychiatric patient for the first time? مریض روانی را که دیده باشن در شفاخانه. شاگرد هستن 5 اگه هستن اونا که دیده باشن. Do you want
ما
to share
خودم
a story?
گستاس
Okay.
دیدیم، یعنی ما خودم که دیدیم استاد همیشه اکثرتشان تو چی می باشه؟ آرام و تو بسیار عاجز می باشه، یعنی در حالت دیپرس مود می باشه. یعنی خب ما زیاد که دیدیم، یعنی زیاد خونه دیدیم، ولی اکثرتشان که فکر میکنم در حالت دیپرس مود می باشه، تو آرام با هیچ کسی صحبت و تو علاقه ندارن که مثلا با کسی صحبت کنه یا مثلا برایشان تو بسابو چی کنه. ما فعلا که تافرن که دیدیم دیگه زیاد.
Oh, sorry, تشکر. I'll talk very slowly, but I will talk in English. I can't explain things in Farsi or Pashto, which is a shame, but this is how it is, okay? I'll talk very, very slowly. So the most important thing is you have to take history from the patient and a family member, especially in psychiatry, because نبید آمدید که مریضا زیاد آرام می باشن، امروز صحبت نمی کنن، ولی یکان مریض می باشه they don't think that they're sick، اونا هیچ فکر نمی کنن که اونا مریض هستن. با خاطر it's very important to ask a family member or somebody who looks after the patient. So and you have to write it that way. History of course انگلیسی نشته میکنه نه؟
What? Sir, what?
History با انگلیسی نشته میکنه نه با فارسی.
چی را استاد؟
History مریضه.
با فارسی است اینجا روی خوست است. در افغانستان خب با فارسی است. در
فارسی
زیادتر
نشته
جای.
میکنن.
در زیادتر.
ما فکر میکنم انگلیسی نشته میکنن.
Teacher is different. The doctors, they write taking histories in English, they write, but some of them you'll be a student in the during of the stage, you'll be write in Dari. But in all of the hospitals, the doctors write taking history in English.
يمكن مثلا
We are in Mazar Sharif, take the fashion history in English.
going to go ahead, but very, very slowly. So I was just emphasizing that you have to ask a family member or a carer about the history as well, because it's really important, because usually psychiatric patients, they don't believe that they are sick. They just think that they're brought to the hospital against their wishes or against their will. So it's important to write who is giving you the history. And it's important که اول نشتم کنین اسمیم از کی گرفتیم یا از مریض گرفتیم یا از خانواده مریض. It's very important to write that down. History of present condition بهتر می باشه که به لغت مریض نشته شود. It's just, it has to be the patient's who write them. مثلا if the patient says که من هیچ تکلیف ندارم فامیلم آورده just write that down as it is in inverted commas. اما رقم که مریض میگه اون رقم باید نشته شود. History, that is the presenting complaints. And as informant یا family member هر چیزی که میگه مثلا فامیلش میگه که they are begged، مثلا میگه که بیخوابی میکنه یا اشتیاقش کم شده یا از خانه میبره یا قد خانواده جنگ میکنه. You have to write it down exactly in the informant's verbatim, and then you have to write the duration که چقدر وقت شده. اینا نفهم کل history و چیزا بر شما عادی خواهد بود، but it's still very important to know how you have to write it down and how clearly in a good handwriting, so that if another doctor is reading it, it's easy for them to read and understand and get a meaning of what you have written down. History of present condition is the most difficult part of history, I think, because it's usually very lengthy, it's very long, and it should depict what the diagnosis is going to be. مثلا هر چیزی که diagnosis بود باید کل علاماتش دیگه نشته شود و به تفصیل نشته شود. مثلا اگر مریض اشتیاقش کم شده you have to write it in detail که اول چقدر نان میخورد، مثلا اول 2 تا نان میخورد حالا 1 تا نان میخوره، یا وزنش چقدر کم شده، یا چرا نان نمیخوره، یا اشتیا نداره، یا میگه که my family has poisoned my food، یا میگه که فامیل دغزا این زار انداخته، یا میخواه که مرا بکشن. This kind of symptoms, so you have to write it down why the patient is not eating, for example. But this can be any symptom, but you have to go in the details of those symptoms, and you have to write it in. It's significant enough that they have to understand what you have written. You have to describe all of them in detail. Then the second thing is family history. Can anybody tell me the family history? I know people might but still, I just want, okay, Najma.
Mom, family history is so related to the disease. In the family history, we can ask from a patient that if your mother is have some of diseases like hypertension, diabetes, and some of cardiac disease have that, or your father's, and we can ask the near member of her family, father, mother, brother, and sister. We can ask that if there are any disease your member of family have or not, and it's so important because some of the diseases depend to the family members. Maybe his or her mother is diabetes or hypertension. Maybe her son or daughter also suspect to the hypertension or diabetes.
Very good. Very good. And it's because a lot of illnesses are genetic. They can be inherited. So you have to ask the patient or the family member about the family history. And in the family history, you have to write it very clear. If you don't want to ask specifically, just ask them what do they have, and then you can exclude fishar, shakar, charbi khun, and then you can exclude all of these. There's first degree relatives and there is second degree relatives. She has first degree chiramiga and second degree chiramiga. Anybody can raise their hands. Anybody wants to tell me what's first degree relatives and second degree relatives? Chiramigan. No? First degree mother, padar, brother. This is first degree relatives, okay? I just want to read the messages, sorry. Offering. Cousins, Mursal mega cousins, Shazia mega brother and sister. Sorry. So first degree is just mother, father, khahar, brother. That is first degree relatives. Cousins, mama, khala, amma, kaka, they're all second degree relatives, okay? So cousins are second degree, maybe third degree. With cousins, we share just one uncle or one auntie. If we are not related to shawar amma or shawar khala, then it's just second degree, third degree actually. So the most important history is the first degree relatives, mother, father, khahar, brother. If they have, especially if they have a psychiatric illness has, it's really important in genetics. That is the most important thing, genetics. If you are genetically prone, if you have genetics in your family, or if you have a family history of psychiatric illness, you're much, much prone to get a psychiatric illness rather than having family stressors or problems in life. So that's where you write the family history. And then in a little detail, after you write all the psychiatric or medical history of the family, first degree and second degree relatives, you might write about چند خواهر برادر هستن مثلا تکالیف دارن یا ندارن یکی از اوقاتش هم این چند خواهر برادر هستن و how is the relationship of the patient with the family members. That's very important as well. And مثلا what is the like what's the sequence مثلا اگه 5 خواهر هستن 3 برادر مریض موقع است که چندم است. So you just write if the patient is third in 7 siblings or 8 siblings after that version. And anybody wants to discuss a bit about the personal history? Do you know where we start personal history from? No? Najma? Sure.
Ma'am, in a part of personal history, there are some about addiction of passion if their passion is
از کجا
addicted.
شروع میکنیم از همون ترتیبش بگو که از کجا شروع میکنیم addiction is just okay
Okay,
where do we start from about
yes, first I think we asked that the patient is married or single.
okay
Yeah, because other history like name and age there asked in the first, and in this part we can ask the or he's single or not, and also we can ask about addiction of her that the patient is addicted to something like alcohol or
Good.
cigarette.
Okay. What?
Yes.
Okay. That's very good, Najma. But you start with childhood history. Don't go in a sequence. Start when the patient was born. Okay. When the patient was in the mother's womb, was there any problem? Did the mother had any infections? Did the mother had any problems? How was the birth? Was it normal? Was it a C-section? Were there any complications with the birth? And when the baby was born, where was the baby born? At home or the hospital? Most of us, we were born in the homes, but still, you need to ask them. Then, so pregnancy, which is called prenatal, natal, or postnatal history. Then you ask about birth history, any complications during birth. You just go with the sequence. Then you ask about milestones. Can anybody tell me what milestones are? I'm not reading the messages, so please raise your hands and talk because I can't read the messages and talk and host as well. Shazia, okay. Milestones.
Yes, ma'am. Milestones are some important characteristics that a child has. For example, like the ability to walk, the ability
Good.
to talk, and also crawling.
Very
These
good.
things are
Exactly. That's milestones. So you ask about neck holding.
Yes.
That's correct. You ask about neck holding. Says مادرها رو یادشان می باشه. خدا کنه که 10 تا طفلم داشته باشن از کلشان یادش می باشه. Neck holding, walking, first word, crawling, all of these things are very important. They're important in terms, especially in terms of psychiatric illness and in terms of IQ or mental retardation. I haven't worked in Afghanistan, sadly. I will, inshallah, but I have worked in Pakistan for a few years. And I used to see a lot of patients were brought in saying that they have psychiatric problems, but they actually had IQ problems or intelligence problems. So, and when you ask these things, but when you ask these things, they left school because they couldn't do it. But at the same time, they keep saying they come to a point that you actually realize the patient has IQ problems and not psychiatric illness, which are two different things. Tomorrow we will discuss briefly about psychiatric illnesses, but I really want all of you to talk. I can understand Farsi Pashto, but I can't give a lecture in Farsi or Pashto, which is bad, but still I can do it. So just feel free to talk in Farsi or Pashto. I can understand both fully well. So that's where personal history is. You start with, as I said, I'm going to repeat it again. You start with pregnancy, when the patient was in the mother's womb. Shazi raised her hand, okay? Shazi, چیزی میخوای بگویی؟ No?
Mom, I think her internet connection is weak. That's the reason. You can go ahead.
Okay, okay.
Yes, ma'am. There is a problem with. Yes, I want to say something.
Oh, sure.
Can you hear?
صدایت خوب شد. بگو.
Goodness.
شازی امیر خیلی نشتک کده چت ما بخوانم. I can't hear you.
Can you hear?
No, I can't. I can, but it's very slurry. Okay, we're going to go ahead and this text. So I'm just sorry, I'm repeating a lot because there's a lot of disruption, but that's okay. From pregnancy, when the patient was in the mother's womb, to their birth, to neck holding, crawling, talking, walking, bladder control, که چه وقت میتونه خودش تشناب بره. Because some people who have IQ problems, again, they can be 7 or 6 and they might more older than 7 or 6 and they might need their mother to take them to the tashnab. So that's very important to ask as well. That's about toilet training and all of that. Sorry. And then in personal history, you go to schooling, okay? How good the student, the patient was when they were in school. مکتب خوش داشت نداشت, because some children, they're not good in school and that's why they start disliking school, because they cannot learn properly. So that's very important to ask how the patient was in school, and if they left مثلا صنف سه یا چهار بعد از مکتب نرفته, you have to ask چرا نرفته. So that would be very important as well. And then so after education, you have to ask about work history. Work history would be very important as well. And then you go for marriage. So just go step by step. اما بس مشکل برین باز خب هیچ چیز باز از زیاد تنم نمیره. مکتبش کارش و بعد از زواج کرده یعنی. Marriage, and if they have children, and how is the relationship with the husband or wife, with the partner. And then about drugs. And forensic would be very important as well, especially I think in Afghanistan it would be more important for men, but still you have to ask for women as well if you suspect it. If you don't, that's okay. And that's how that the personal history ends with drugs and forensic history, which you have to see.
صوت من همراه صدایش کم مشکل دارم، نمی‌فهم کسی دیگه هم داره یا نه. یک بارگی ضعیف میشه باز پس قوی میشه و رشته درس از ساده میره استاد.
I'm so sorry. I don't know چرا تو میشه چون اینجا اینترنت مشکل نداره ولی sorry. I'll just try my earphones and then you can let me know.
استاد محترم که داغه موشته که ما په نظر گوشگی موشته که شاید خسی نه بگم گوشگی ستون زده کدی اینترنت ستون زده.
گوشکی آلمان بس ولید گفت که کد گوشکی صحیح نیست. آلمان گوشکی ماندیم صحیح شده.
او صحیح شد استاد. چرا شاید موشت تاخیره نه بگم څه مشکل ده.
Okay, sorry. صحیح میاد. بهتر شد یعنی.
او صحیح ده بالکل بیخی صحیح.
Sorry. کاش که اول میگفتن ما گوشکی گرفته بودم ولی گفت که گوشکی صحیح نمیاد به خاطر کشیدم.
استاد فعلا درست است.
اوکی
مسئولین عزیز لطفا ریکارد آن زیاد صحبت نکنین. مایکاتون آف کنین. مشکل بود داکومنت نشته کنین. من میبینم بازم رای میدیوم شریک میسازم. تشکر. استاد شما میتونید شروع کنین.
Okay, so you just go personal history, that's done. You go to past illness. You can take past illness in two ways. The illnesses which were diagnosed in the past, يعني مثلا the past تشخيص شده بود. مثلا the patient has hypertension and was diagnosed 10 years back. That will be in past illness. و يقولون میگن که تکالیفی که جور شده حالا اونا the past illness the illness which have recovered and the patient does not have those illnesses anymore. That is part of the past illness. من نمیفهم شما چه قسم میکنید past illness چه قسم بیشتر میکنید. Okay, Najma.
Ma'am, as I see inside the hospital and the some hospital in the part of the past illness, they write about some of past diseases that the patient have passed on that, and also ask about some past surgical operation. They ask about
نه خب
operation also.
مثلا اگه مریض مثلا اگه آن مریض پیش آمده تکلیف اعصاب داره 10 سال قبل فشار تشخیص شده بود. صحیح؟ از the past نشته میکنین at the present. ما حالا فشار داره مریض.
استاد پاس نمیشه بخاطر که پاس
نجمه خود گپ میزنی؟ Sorry.
ما صحبت میکنم این مایکای دیگه خودم آف کنم. مسئولین عزیز لطفا مایکایتون آف کنین. هر سوال یا جواب میخواستین بتین اینجا آپشن دست رو بلند کنین. باز استاد نامایتون گرفته صدا میکنه. استاد ما را بیایم به جواب سوال. استاد یه پس میگیریم بخاطر که قبلا داشته و ممکن به شکل پیریودی قبلا داشت باز دوا گرفته تحت تداوی بوده و او هایپرتنشنش مثلا گم شده اما دوباره باز به شکل دوباره رجعت کرد یا برگشت کرد دوباره پیدا شد اما این قبلا داشته پس ما را در پست هیستوری نشته میکنیم.
اوکی صحیح است. اینجا هم رقم میکنن ولی من نمیکنم but that's okay. هر چیزی که the past diagnosed شده می باشه you just write it in the past illness but that would be very important as well because there can be some contraindications to the medications you're giving, especially psychiatric medications. Anybody wants to become a psychiatrist in the 17 participants? کسی میخوای در آنی متخصص بگیره؟ No? Okay. So that's past illness, that's done. Personality. So in personality, you usually ask about, it's very hard to explain in Farsi or Pashto, I'm sorry, so I'm just going to simplify it in very simple English words. You ask about the patient behaviors. Masalan, there can be two sisters, both in the same family, but they might react differently to the death of their mother. Okay? Because everybody has their own personality and everyone has their own way of coping with stress. So that's what you need to ask about the patient's personality. And you can't ask the patient, you have to ask a family member or somebody who cares for the patient. You have to ask about the patient's personality before illness. If now they come to you with depression, you need to ask about their past history. And for example, you ask, مثلا اگر چیز مشکل پیش می آمد, how would the patient react? How would the patient behave? If the patient gets angry, how would they behave? There are some people who get very angry. There are some people who don't get angry. So that's just part of your personality. And it's different for different people. And I haven't seen I haven't worked in Afghanistan, so I haven't seen what kind of problems people can have. But personality problems is very common here in Ireland, or here in Europe in general, not just in Ireland. But I think Afghanistan is good. It's much better in terms of personality. So that's how you need to ask some patients, the family member, about the patient's personality and how they react to certain situations, how they react to stress. and all of these conditions. Anybody has a question up till now about these points that I discussed? There are 10 messages in the chat. Massive message, I'm sorry. Should we take questions in the end? Okay, that's good.
Ma'am, sorry,
Sorry?
we can take a question from a student in the end of the lectures.
Okay,
Because now
yeah,
the
I think so.
recording is on.
Okay, that's a good option. Okay. These are the things you need to ask about personality. Okay, that's very important, and this is very difficult to take as well. So not about personality, sorry, about the personal history, and I discussed all of these. So the mother's pregnancy and birth, early development, how the child was with the patient, with emotional problems, their education, their work, their relationships. Well, in Afghanistan, you just ask about marriage. You don't ask these things because these things don't happen, which is good. How many children they have, their social circumstances, their source of income, substance use, forensic history. We discussed all of these just in the gone slides. So I'll take questions in the end. I just have 5 slides because I want it to be very interactive. But since the cameras are off, so we can't interact as much as we should, but that's okay. I won't be able to describe mental state examination in Farsi or Pashto, so I'm just going to describe it very simply. A physical examination as the surgery or the medicine, there is a mental state examination in psychiatry because there are no blood tests or there are no signs or symptoms in terms of physical examination to diagnose a psychiatric illness, but just by observing the patient, observing how they are dressed, how they behave, how are they sitting on a chair, and how they talk, all of this is called mental state examination. It's a very, very important part of the psychiatric assessment. And you will get, like, if you are interested in psychiatry, you will get experience by looking at the patient. Even now, I don't have a lot of experience in psychiatry, but with my 8 or 9 years of experience, if I see a patient, I talk to them for 1 minute, I can make a diagnosis based on the mental state examination. That's how important it is. Even if you don't have a history, you talk to the patient for 2 minutes and you'll get to know what the diagnosis is, but that will depend on your experience and your interest in psychiatry. So appearance and behavior, it's very important. Masalan, you can see a man roaming around just wearing one shirt in minus 5 degrees centigrade in Kabul or somewhere. And this person is just wearing one shirt. Or sometimes in July, as the Asad Saratan, you might see somebody wearing a coat in Jalalabad, for example, which is really hot. So that's how you notice things in a mental state examination. Somebody is sitting in your clinic, you observe how they are dressed. Masalan, Pakis of Ayesha tells a lot about diagnosis of the patient. For example, if somebody is depressed, they might have unclean hair, or they might be looking down, they might not make an eye contact with you. All of these is very important in diagnosing the patient. And actually, it's a confirmation of what the patient is telling you. Then speech. If you see, I'm not sure how many of you have seen how many psychiatric patients, but if you see a patient who has a psychotic illness, their speech can be very irrelevant. Masalan, I shouldn't say bemana, but I don't have an appropriate word in Farsi. You ask them one thing and they just answer you something very inappropriate, which does not make any sense. So that's how you actually write a sample of speech. You write it as it is, and you read it later, and you get a lot of understanding of what's going on in the patient's head in terms of illness. Then mood. I have to ask this question here. I can't ask this in the end because I just want to ask, how would you ask about mood in Farsi or Pashto? Or have you ever asked a patient about mood? What would you say to them? I really want somebody to answer me here. Shazia, okay? بدری بگو دری یا پشتو عکس که میخوای
زندگی چی هست این روزا کدام یعنی زندگی با زندگی دوتا میشه
صدای ده کمک it was very blood یک دفعه دوباره بگو sorry صدای ده کمک جار شده یک دفعه دوباره بگو نجمه raise her hand okay با فارسی چه قسم پرسان باید کنیم مریضه خاطر مود نجمه اوکی چی میگی؟
یا استاد پرسان میکنیم میگیم ایروز مثلا اول درباره که درباره خویش پرسان میکنیم خصلتایش مثلا رفتارش که فامیل چه
نه
قسم
خویش چه قسم پرسان نه خویش چه قسم
مثلا
پرسان
فکر
چی میگی؟
مثلا میگم در خانه چه قسم مثلا صاحب خرابی میکنی یا نه باز میگه که میکنم یا نمیکنم
No, I want to ask about sadness, not about asal kharabi. That kar meane bas. I want to ask about sadness.
مثلا میگم جای چی خوشت میاد جایی که بسیار تنها باشه تاریک باشه و در گوشه باشه و تو یک جای خوش داری یا میخوای که با مثلا در اطرافت مثلا بیروبار باشه یا همگی باشه اینطوری
خب این رقم نخواد گفتیم که در مجموع روزانه مثلا در روزمره زندگی خود خوش می باشی یا خفه این رقم کدام سوال can you make a question like this a very simple one to ask about happy or sad mood
yeah teacher we can ask that
چه قسم خواهد گفتی
مثلا می زندگی مثلا از زندگیت که فعلا در حال جریان از خوش هستی چی کدام چیز زنده
yeah that's a very good question and it's a very good question about mood as well but I just didn't know how to ask it in Farsi that's a very good way of asking it که مثلا از زندگی خوش هستی یا نه and then you have to ask about interests as well here مثلا میگی که اگه خود مریض آمده باشه پیشت with depression then you ask them که do you enjoy things that you used to enjoy previously مثلا چیزایی که اول خوشت میامد مثلا باروسی رفتن یا به خانواده یک جای شدن عالم از چیزا خوشت میاد یا نه so that would be very important question in asking about interests or lack of interest so the patients would tell you مثلا ما رقم مریضا رو دیدیم افغان مریضا رو در پاکستان and they tell you even I don't even like hugging my children so that's a very significant symptom of depression if a mother says to you that I don't like even hugging my child so that would be very important and you ask the patients in that way how do you enjoy your child's company خوش می باشی یا اونا خوش شون تو هم خوش میشی so that would be very important for father for mother both of them that would be very good form of way of asking somebody about their mood then about their thoughts thoughts would be very complicated again especially in a psychotic person and we can discuss that maybe in a separate lecture but in general you just ask you don't need to ask them about thoughts if there's a family member with them they will tell you what the patient is doing and that would be a way of that will be a portray of their thoughts that will tell you what their thoughts are like but still if somebody is severely depressed then you ask them about suicide as well شاگردان صنف 5 که در اتاق جلد emergency می باشن do you see patients coming with suicidal attempts or overdoses of drugs or تیزاب or anything like this میبینین این رقم مریضا زیاد می باشن یا کم hello anybody who wants to please answer this this is the last slide anyway so I think we should discuss it in detail and it's very important as well no I don't think anybody's listening to me anyway
مسئولین عزیز جوابش میتونین دستایتان بالا کنین میتونین بگوین استاد نظری ما است یا بعد افغانستان از این قسم بسیار زیاد است خصوصا در بین جوانان زیاد از دراگ استفاده میکنن. یک دراگ دیگه که بسیار ادکت هستن یعنی جنریشن ناو یانگ جنریشن به یک دونه چی است و چی میگنش فراموشم شده او زیاد استفاده
تبلیت
میکنن.
کی؟
یا تبلت که ای
ما
بسیار زیاد
شنیدیم زیاد افغانستان خونه.
ای بسیار زیاد از استفاده میکنن و معمولا زیاد هستن در شفاخانه. من خودم شخصا کتش روبرو نشدیم همچون یک واقعه، اما زیاد است دارم خیلی از این واقعیات.
well then would they come with a suicidal intent مثلا تبلیت کی استفاده میکنن نو خبر they're just using it as a drug to get a high or get an enjoyment from the drug, but I'm just saying as suicide مثلا تیزاب میخورن you cut their hands or something like that.
Yes, yeah, I have. تیچر ما در یک سپلای ما رفته بودیم، یک واقعه بود. خودش نخورده بود، شوهرش به همسرش داده بود به زور تیزاب، با زور خورده بود. باز ایده ایمرجنسی آورده بودن و زیاد خانم زیاد ایره یک هفته قبل بهش داده بود اما ایره نآورده بودن. یک هفته یعنی ایره هیچ پیش دکتر نبرده بودن و ای پیش بود. ای بسیار وضعیت از خراب شده بود، گلون از بخی یک شکل دیگر گرفته بود. ما اونجا زیاد باز دیگه اجازه ندادن که ما پیش بریم، اما حالت او خانم هم بسیار خراب بود.
And do you know why that is چنانکه کس تیزاب بخوره the esophagus will get stuck and there will be adhesions because of which the patient cannot swallow and then they lose a lot of weight. او وقت خونه میمورن که بخورن ولی در 6 ماه بیچاره باز.
Let me tell you about this issue. If I'm just only allowed to tell you about this one.
Sure.
You know, we have such kind of patients. They are coming with a suicidal attempt, as it was earlier told. You know, suicidal attempt doesn't mean that only a person who is giving. It means the second person is the responsible for that. It is not suicidal attempts for the patient. The patient, it is, you know, a self-activity.
Thanks, Najma. I just want to say, so to summarize, the thing is overdoses, it's universal. It's more common in women all over the world. It's most commonly in young women and women all over the world, whether it's Afghanistan or it's Europe. It's more common in women. And the most common things in Afghanistan would be organophosphates, paracetamol, and psychotropic medications like amitriptyline, which can be very toxic. Again, all of them are very toxic. Like paracetamol, it can be very toxic to your liver. It causes permanent liver failure. You have to do a blood paracetamol level and then give a NAC or N-acetylcysteine to save the patient's life, or do LFTs or monitor them for a few days or even weeks because it can have later effects. So an organophosphates very, very toxic again, and it's very easily available. It's very easy to buy it and take it, and sometimes toxic, but it's very toxic. And I think the mortality rate is more than 99% if it's not treated on right time. So the mortality rate for organophosphate is very high. Paracetamol causes fulminant liver failure, and amitriptyline, it can cause heart failure or cardiac death. So all of them are very toxic methods which are used in Afghanistan. I don't know any studies. That's why I was asking you people about studies in Afghanistan. I haven't worked there. And so that was about poisoning and what people can do. So that's important. I don't know how did we jump to poisoning, or maybe I asked a question. So that's important about thoughts. You have to ask about suicide. There's a study done by Musalmana where Jews, Yahudi Mardom, suicide is much less because religion is a protective factor. So that's the one good thing that we have. Thank God that suicide happens less in people who are religious, especially Muslims and Jews. So that protects from suicide. And as I said, in thoughts, it depends on the patient, what the patient's diagnosis is. But generally, if you see a patient with depression, you do ask them about suicide. If the patient is psychotic, you do ask them about if they have any ideas to harm other people. That would be very important as well. In perceptions, it's very, very complicated for me to explain in Farsi, but you have to understand there are patients who are psychotic, who hear voices or who see things or who have very abnormal experiences. مثلا باز در افغانستان یا در ممالک ما شما افغانستان باشه پاکستان کل جایا they usually talk about jinn, siya jadoo, siya taweez kadan, all kinds of these things, but usually the patient actually can have a psychotic experience. So in perceptual disturbances, you observe the patient. Sometimes they can be self-talking, or they can be talking to the voices that they're hearing. I think maybe if you all open your books and you study about perceptual disturbances or auditory hallucinations, it'd be very interesting. And you can ask me questions tomorrow. We have a lecture tomorrow as well. In cognitive assessment, I'm just going to summarize it quickly. You ask the patient about orientation to time, place, and person. مثلا خودک معرفی کرده باشین you just ask them یادت هست که من کی هستم حالا ما کجا هستیم ساعت چند باشه تقریبا. So you ask these things, but there are other tests for memory like mini mental state examination. You can Google that and you can find it out. It's a small questionnaire, and you do it on patients, especially on old patients. But generally, you just ask the patient if they recognize people around themselves, if they know what the time is roughly, or if they know where we are at the moment. Questions like this. And the last point is insight. And that's very important when you ask the patient if they think that they are sick or not. مثلا, you ask them, يعني فكر ميكن كبار تداوي ضرورات داري يا بردا وزن داري أنا. So you ask the patient these questions because usually psychotic patients think that they're not sick, that they're not unwell. And sometimes it's very difficult to give them medicines as well. And I'm sure in Afghanistan you can just hide the tablet in the food and give it to the patient. But here you can't do these things. So it can become very difficult when the patients have no insight in their illness. If somebody has appendix, they would go to the doctor, get rid of the appendix. But if somebody has a psychotic illness or a severe psychiatric illness, they might think that they don't have an illness, so they will not take medication. So it becomes very difficult, and it's difficult to explain, especially. I'm going to mute Farzana. That's okay.
Dr. Farzana, mute your mic. Mute. Mom, you can mute them.
Okay. There are only 13 people left. Okay. So sorry, that's it. That was my last slide, and I think we discussed enough. Unless if anybody has any questions, we can talk. Otherwise, you can just you can finish it. Anybody has any questions, you can write it down, raise your hands, or just ask if you want. Otherwise, we'll just end the lecture.
Thank you so much, Dr. Ayesha, for such an amazing lectures. Madam, now we can off the recording option, and after that, you can let to a student to ask their questions.
Okay. Stop. So where do I stop the recording? Okay. Let's stop recording.